Good afternoon and welcome to today's live surgery. This is Soo-Hwan Byun. It is a great honor to be attending today's live surgery as a moderator. Today's live surgery will be performed by Professor Soo-Hwan Byun. He is a professor at the Department of Oral and Maxillofacial Surgery in Hallo Medical Center. Since he has abundant experience in implant surgeries, I believe that today's program would be of great help to the surgeons watching this video. Today, we will search for the answer to the following question. How do we solve the implant displaced into the maxillary sinus? Before we go right into the surgery, I will be providing a brief description of the patient information. The patient is a 51-year-old male who has been referred from the local dental clinic after the fixture had been sunk into the right maxillary sinus. 9 months ago, the fixture was removed in Hallo Medical Center. Meanwhile, implant placement following lateral sinus augmentation has been performed on the left posterior side. The patient had no special medical history. This is the panoramic view of the patient at the first visit. As you can see, the fixture is displaced into the right maxillary sinus. There we are looking at the tomographic images of the right maxillary sinus. You can see granulation tissue around the fixture. A proper solution to the fixture displaced into the maxillary sinus is to remove it. In order to remove it, you need to make a lateral window to make an incision to the sinus membrane, and then make an approach into the sinus membrane. In this case, the fixture was removed through a lateral approach. On the right side is the picture of the fixture. After the removal, it is very important to facilitate the next steps to place the implants. There are two ways to choose. First, you can just remove the fixture. Or second, you can remove it and then carry out sinus augmentation and bone graft simultaneously. Today's live surgery shows the first case. However, if you remove the fixture and just leave, ankylosis can occur between periosteum and sinus membrane because there's no lateral window between them. In that case, you may have much difficult time elevating the sinus membrane in the future. And this can elevate a risk for damaging the membrane. Therefore, it is important to make a reliable barrier between the periosteum and the membrane, which is not easily resorbed and maintains its strength for a long time. For this reason, we chose collagen membrane from Dentium. Collagen plug was used to fill the extraction site, and the collagen membrane was used to cover the lateral window area. As for the left side, on the other hand, lateral sinus augmentation was performed. Fixtures replacing tooth number 25 and 26 were placed on the same day. For the sinus augmentation, osteoinzeno was used to fill up the area beneath the sinus membrane, and collagen membrane too was also used to cover this area. So, when it comes to today's surgical plan, Professor Byun will be placing implants for tooth number 16 and 15 under intravenous sedation. In this case, superline implant from Dentium will be used using digital guide system. Sinus augmentation will also be performed. We will now be looking through the preoperative images of the patient. This is the panoramic image of the patient. As you can see, there's no sign of inflammation on the right maxillary sinus. These are the intraoral photos of the patient. They are showing the right and the left side respectively. Also, the upper and the lower side of the intraoral space is shown. These are the tomographic images of the second premolar area. You can recognize that there's very scant amount of bone around this area. And these are the tomographic images of the first molar area. A bit better than the premolar area, but this area also lacks residual bone. These are the captured images of designing the digital guide. After carefully confirming the final location of the implant, a tooth-borne digital guide is designed. This is the final position planned for tooth number 15. And this is the final position planned for tooth number 16. We will be introducing a similar case to show a different approach. The fixture was also displaced into the right maxillary sinus. But here we have removed the fixture and performed sinus augmentation on the same day. These are the tomographic images. For this patient, fixture was removed through a lateral approach. To carry out sinus augmentation and bone graft consecutively, you can either suture the sinus membrane or cover it. In this case, the perforated sinus membrane was meticulously sutured with nylon number 60. The membrane was then covered again with collagen membrane. Then the bone graft was performed. With these procedures, you can simply place the implant in the next time. Dentium collagen membrane supports the perforated part of the membrane and lower the risk for possible complications. Collagen plug was also used in this case to fill up the extraction site of tooth number 17. In this tomographic image, the augmented area seems quite satisfactory. These are the post-operative images of the patient. The extraction site was nicely healed. Now let's proceed to the surgery. During medical procedures, please do not hesitate to leave the comments regarding the surgery. The first important step of the guided surgery is the stable seating of the surgical guide. The prefabricated guide with metal sleeves is seated firmly with a finger. Through those drilling holes, the planned location of the fixture is being marked. After removing the surgical guide from the intraoral space, the surgeon checks the marks and then starts making the crestal incision. Notice that the incision line is slightly deviated to the palatal side. The circular incision is also made. The incision line slightly deviated to the palatal side helps us to save more amount of keratinized tissue for the implant. To facilitate the approach to the maxillary sinus, it is very helpful if you ask the patient to slightly close their mouth. The vertical incision was made from the first premolar and the circular incision was also made. The flap is being elevated with the periosteal elevator. In this case, flap elevation is not an easy process. It's because the granulation tissue has grown after the sinus perforation and fixture deviation. Notice that it is particularly difficult as you get near to maxillary sinus. Mass of granulation tissue is adhered to the flap tissue. As mentioned before, collagen membrane previously used to cover the sinus is being removed. This is the membrane. In terms of collagen membrane 2 from Dentium, it was previously applied to cover the lateral window. Collagen membrane 2 is a resorbable barrier membrane claimed to show a long-term stability for over 6 months. And as you have seen, the membrane exists still after 9 months. For the next step, the surgeon is carefully detaching the sinus membrane from the bone. Unsupported bone fragments are being removed along with the granulation tissue. You may have noticed that the residual bone is quite thin. The yellow-gold color of the appliance can be seen through the bone. And we can also see the tunneling perforation. Then the membrane is elevated from the alveolar crest through the tunnel.
좀 졸리세요? 괜찮으세요? 네. 네가 거예요.
Membrane detachment and elevation is also not an easy process in this case, because the scar tissue has been formed from the prior surgery. That is another fraction of the collagen membrane. He is removing it. And as we have seen, the membrane exists still after 9 months. After the tricky process is finished, the surgical guide is being seated again to check the planned site for the fixture. Now the surgeon is proceeding to the drilling process. He's making sure that the membrane is detached without additional perforations.
왼쪽을 조금만 돌릴게요. 왼쪽. 조금 돌릴게요.
There we are, positioning number 16, slightly different from what we've planned. That's because there was lack of bone around this area, which made a tunnel right into the sinus membrane. The planned position of the fixture is thought to be ideal, but sometimes we need to switch our plan if the bone condition is far from our expectations. Implant system we are using in today's live surgery is super line provided by Dentium. The primary reason for using super line is to compensate for the scant amount and poor quality of the bone. We believe that there must be a reason for the displacement at the first place. We assume that their bone quality should be poor, and CBCT images showed poor quantity and quality of the bone. Superline can be a good choice in situations of this kind, since its tapered fixture is claimed to show us good stability within a small amount of bone. He is now putting collagen membrane 2 under the sinus membrane. As mentioned before, collagen membrane 2 boasts good stability over 6 months. And this membrane is a soft type. This membrane boasts faster wetting and easier manipulation. It also boasts pin-friendly traits. There are several options to cope with perforation on sinus membrane. You can carefully suture it with very thin nylon or cover it with long-lasting collagen membrane. The latter can be a simple and easy choice compared to the former. After he made sure that the membrane is secured in a desired place, he is filling up the space with particulate bone graft material. The graft material being used is osteoxeno, provided by Dentium. Conjectured from its name, it's a bovine grafting material with osteoconductivity. Its porous structure is claimed to be similar to that of human bone. And organic substance is completely removed in this material. You can see the particles gradually filling up the gap. Particles are being applied in a compact manner. Scant amount of residual bone requires much greater amount of bone. Finally, the fixture is being placed for tooth number 15. The size of the fixture is 4 millimeters in diameter and 8 millimeters in its length. Fixture for tooth number 16 is being placed. As mentioned before, the reason we have chosen the superline implant is because it shows good primary stability when in a poor condition of the bone. The main reason for its high stability is the double and sharp thread. Additional bone particles are being grafted.
이거보다 하나 작은 거 있죠? 그거 주시겠어요?
He's putting more particles of osteoinzano on the crystal side. Now he's covering the lateral window area with collagen membrane. And a smaller membrane is being used to cover the crystal side. Carefully handling the membrane is closing the flap. It is important that you make key sutures on important sites first and then head to the other area. Silk is using is Dafalone 40 to 50. This is actually a simple process, but we need to make sure that the flap is closed nicely with minimum tension.
더 주세요.
After the surgery is finished, we will be having a short break and then be back with the Q&A section. If you still have the questions, please do not hesitate to leave the comment. Thank you so much for watching the surgery, and we will be having a short break. Thank you.